Hi, I'm Brad Coulter and this is Looking Back. In the early part of 1918, Woodrow Wilson was beginning his 6th year as president. World War I was in full battle and many Connersville young men were on their way to the Western Front. It was in the spring when word of a dangerous flu began to filter across the country. In 1918, many serious health conditions existed. Tuberculosis and diabetes were a death sentence, and 15% of all babies did not survive their first year. Americans weren't immediately afraid of another story about the flu. As 1918 progressed, those fears did become prevalent as the influenza, or Spanish flu as it was named in the early days, gripped the city, county, and the world. The Spanish flu name was dropped after it was learned that it had originated in Kansas. Troop movements and the full dedication to victory in the war helped spread the influenza around the world. Similarities between today's COVID-19 pandemic and the 1918 pandemic are eerie. The rules are much the same even if the political correctness was not as prevalent. One of the major differences was that the city, in conjunction with the Chamber of Commerce, set up an influenza commission. The manager and secretary of the chamber was put in charge of the enforcement arm of the commission with the full support of the police department. Community leaders were put on the commission with the names Anstead, Theobald, and Hull as members giving it weight. Mr. Edward Tiffett was Deputy Health Commissioner in charge. Rule number 1 was the quarantine. When a home was considered quarantined, a placard was hung on your door by the police department notifying the public that your household contained the influenza, and no entrance or exit was permitted. Most other policies were similar to those of the 2020 pandemic. Limited attendance in restaurants, funerals, and theaters, and school events was the norm. Mayor Charlie Ryder helped formulate the response by the city, and other city fathers and businessmen helped sell the ideas to the townspeople. Fayette Memorial Hospital helped treat the sick as the summer wore on. The hospital's 38 beds were usually inhabited by 30 influenza victims. Normally, about half of the sick were without the ability to pay, but local charity at the time made up the difference. At least one local nurse, Miss Nora Snyder, died of the influenza that she had contracted from one of her patients. Just like today, the nurses, doctors, and police were all on the front line of care and exposed to the pandemic. Much the same as today, masks were highly encouraged but not mandated. Some were in full support of the mask, but others were opposed. There was even a local anti-mask league. In the fall of 1918, things began to get worse, and an event that happened in early November helped cause the pandemic to take a bad turn in Fayette County and Connersville. In the wee hours of November 11th, word came to Connersville that World War I had ended. The relieved people of Connersville took to the streets, and the next day headline in the Connersville Evening News was "The city is in a joy riot." A cannon was fired downtown, and an unplanned parade sprang forth. It is said that no member of the city's population was not in attendance. As can be expected, the jubilance caused a lot of additional exposure, and the influenza took off in the county for the next couple of months. Connersville in 1918 was a remarkably busy and happening city. No less than 24 local companies were making parts for the war. Frederick Barrows led the effort to procure local war contracts for local manufacturers, and it is said by all that he had mastered it. In September, a local delegation of 24 made its way to the christening of the freighter Connersville. They rode in brand new Lexington town cars provided by the Lexington plant. Things were almost too busy to slow down for the pandemic. By November, people were getting ill and the number of deaths had become alarming. By December 7th, 41 locals had died from influenza, and over the next month, about 10 more were dying each week. About 30 new cases were reported each day well into January. On January 10, 1919, Connersville was into the second of 3 waves of the pandemic, and 118 homes were placarded with 342 people sick in the county. By February, the cases were starting to recede, but were still at 24 new cases a day. The deaths affected people in the 20 to 40 age group, and the city lost many of its best and brightest during this time. The pandemic continued to a lesser degree and through a final and less deadly wave into early 1920. Even President Wilson, who had a stroke in 1919, contracted the flu in 1920, and for a time it was feared that the weakened president wouldn't survive. In all, Connersville came through this period well. The 1920s in Connersville may be considered its periods of best growth and expansion. Local control and cooperation during the worst days of the pandemic no doubt helped Connersville weather one of its greatest storms.